Missionary Hospital, Director of Pilot Medical Diagnostic, and current member, Nigerian Medical Association, History and Writing Committee, Dr. Pa John A. Let's clap for Jesus as he comes up.
Thank you too. Praise the Lord. I'm also the secretary, Rivers Family Health Workers Forum. We started the forum with Pastor Dikibo, and today the forum has grown across all the regions. May God be praised. Please, because of time, our daddy has talked about rebellion. For me not to be the first person to be rebellious, I must keep to the time allotted to me. That's 15 minutes. Because of the time, I may not say everything. I will quickly talk about what the men have that women do not have it. And that will be the prostate, about the prostate. Before I talk about that, there's this practice among people in this part of the world. They only go to hospital when they are sick. Most of them come to the hospital when they have come down with complications. That should not be so. The book of Proverbs says that the wise will see the danger coming and run into a shelter, but the foolish will see danger coming and start quoting Bible. I know the God I'm serving. I am this, I'm that. God was not stupid by allowing people like us to go into the medical field. So the way it is in other climes, you should be checking your health regularly. It's not only for the fathers, it is also for the mothers. There's nothing big in checking your BP, checking your sugar, or just going to a hospital manned by a medical doctor to run basic medical tests. It's very important because most of the people come to hospital, if it is somebody that has cancer, that can come when it is stage 1, that it can be submissive to medical treatment. They will not come until it is already advanced. At that point, what will happen? You lose the person. Because once he crosses stage 1, going to late stage 2, 3, there's nothing you do. Somebody like the leader of the World Trade Center, Okonjo-Iweala, she proudly tells us that she has cancer. She had cancer. But because of early detection, it was managed. And today she's moving about. But the same thing happened to a former minister, let me not call her name, who is late now. She was diagnosed of cancer in University of Nigeria Teaching Hospital, but she said she wanted to get a second opinion. She traveled abroad, and they told her nonsense. You know, most times we believe that anything in Nigeria should be fake. It's only the doctor's opinion abroad, you know, without knowing that those people you see there are also doctors that train in Nigeria, but because of the system, which is so poor, they decided to migrate abroad. So that former minister was diagnosed of ovarian cancer in UNTH, Enugu, but she decided to seek, you know, second opinion. On getting there, they told her another thing. She came back, and at the end, she died of the same ovarian cancer. So let me not waste time on that. I will also want to tell the church, it is not about saying my father died. You must know what killed your father. It is important because some things run in the family. When the book of Leviticus said you should not marry somebody from your family, it's not that if you marry that person, anything will happen. But some diseases, when you marry somebody from your family, it makes the disease to become so, clear. You know, there are things we call recessive genes. Let me not go into it because of time. Now, I said I'm going to talk about those things that are common among men because we are celebrating Father's Day. First, some people come and say, I went to hospital, they told me I have a prostate. Yes, of course, you should have a prostate as a man that does not have a prostate. Even the baby boy that is born today has a prostate. So, telling you that you have a prostate does not make any sense. You should have a prostate. It should have made sense if they told you that you did not have a prostate, which is not possible. So every man has a prostate. Now, this prostate is just the size of one nut. We all know about one nut. Very small. It is found lower down the bladder. It is important because it secretes what we call prostatic fluid. That prostatic fluid, just like what you see, that thing you call sperm, to us is not sperm, it's semen. That semen contains the prostatic fluid, the sperm itself, seminal fluid, and other contents. Now, that's the prostatic fluid. The function is to guide the sperm wherever the sperm is going. More like if you see a president moving, you see the DSS, police, army, all those security agencies. Their work is to protect the president. So if the sperm is moving, there are things around the sperm. You talk about the prostatic fluid, the seminal fluid, and other stuff. So the prostate secretes the prostatic fluid, which contains citric acid, zinc, enzymes, and other contents. Their function is to guide the sperm so that you cannot easily access the sperm. You can't destroy the sperm. They are more like the soldiers. And also the prostate has a muscle. It helps during ejaculation to push out the semen so that it can enter wherever it is going to. Now, this prostate, we have seen the importance. There are other importance of the prostate. But this prostate tends to get bigger as we get older. And that is why I want to choose the topic. Because most people, some men, suddenly at their late 40s, 50s, you see them with two legs swollen. And of course, the practice we have in this part of the world is if you have an issue, you go to pharmacy. It is improper. You must see a medical doctor. It's the medical doctor that will take your history, do clinical evaluation, do your examination. He will call for tests. Most of us abuse paracetamol. That is the most commonly abused over-the-counter medication. And research has shown even the common paracetamol you abuse, the same paracetamol among women can make the child in your womb not to perform as a man when he is grown. Imagine a drug you took, common paracetamol, you can go and pack as many as you can, you know. Now, in other places, you cannot just wake up and go and buy drugs. You must see a doctor. History has shown it. Even in Israel here, going there, just somebody wanted to buy paracetamol. And the person was asked that you should get a doctor's prescription. Benin Republic and many other places. It's only here you wake up and go to a pharmacy shop and tell them the drugs you want. Because here, the practice of medicine is not properly regulated. So what are we saying? This prostate can cause a lot of problems. Most men, when they will discover it, they've had kidney failure. And they will start calling village people. And some people will say it's a spiritual attack. But they have failed to take care of their health. Because Hosea 4:6 says, my people perish for lack of what? He didn't say money. It's knowledge, simple knowledge. So what are we talking about? That prostate is important. You take care of it. You know about it. Now, this prostate can be affected by 3 common diseases. Just 3. There are other ones, but the common ones are just 3. First, we have what we call prostatitis. Number 2, we talk about the common enlargement, which we call medically BPH. B stands for benign, P stands for prostatic, and the H stands for hyperplasia. We call it benign prostatic hyperplasia, which in a layman's language means enlargement of the prostate. Then number 3 talks about the prostate cancer. Now, these three things I mentioned, they normally have common symptoms. They have common symptoms, which I will try to rush over the symptoms. So that if you have them, you must, as a matter of fact, begin to check your prostate. The test is not costly. With 4,000, you can know 4,000, 5,000, 10,000. You can know about your prostate. When people come to hospital, we always ask them, in the course of history taking, is your father still alive? To you, you may think it has nothing to do with what is happening to you. If in those days, I know, before people will marry, they will send some people to go to this family and make inquiries about them. Do they die early? Is there any sudden death? Those things are still now. It's not diabolical, it's not spiritual. It is purely medical. Because there are some people that have the gene for hypertension. 95% of hypertension occurring in this part of the world is essential hypertension. And it is connected to your gene. So if your father was hypertensive, go to the family. It's not about prayer. Go to the family. 1, 2, 3 persons must be hypertensive. The same thing is applicable to diabetes. Then if there is a history of prostate cancer in the family, what do? You start acting on time. If your father died, our question is, how did he die? But surprisingly, in this part of the world, people hardly check their health. So you just say, he just died. Just like me, in my own family, there is a history of hypertension in the family. How did I know? Because I'm a doctor. I was able to study the family tree. What killed my grandmother? And I kept on tracing it until I found where it came from. Because it either comes from your father or from your mother. Unfortunately for me, it came from my mother's side. Because how my grandmother died was just slept, couldn't wake up. In the morning, they kept on calling her until they broke the door. And they saw her lying that way. And I began to talk to people in my family from my mother's side. Look, there is this. This is what you do. Some of them, of course, ignored me because they are highly religious. They believe God will do everything. Yes, we believe God can do everything. But remember the parable of the 10 virgins. Jesus said 5 were what? 5 were what? Foolish. Even the lineage of Jesus, somebody like Rachel died of childbirth. Somebody like Rachel died of childbirth. Which if it were today, doctors will rush in and operate on her. While delivering Benjamin, she died. And the extra biblical history showed that the head of Benjamin was big. So the woman kept on pushing, giving what we call CPD, pelvic disproportion. So what am I trying to say? These things are clear. It is for us to apply them in our daily life. But if you say you ignore, the question is, why is it so that highly religious nations are dying? Their life expectancy is low compared to those secular nations. Like in Japan, you can see somebody 150-something years. I will still come to that if there is time, so that I will not be rebellious. Now, look at their diet, but we'll talk about that one. Let me finish the prostate, because it pains me when somebody will have a kidney failure, courtesy of common prostate, when you should have taken an action. Do you know how much is dialysis? Do you know, in fact, people I know that had end-stage renal failure, which is kidney failure, do you know they will almost sell everything they have while trying to save themselves? And at the end, they will still die. I hope you understand. Even the dialysis you are rushing to pay for you to be alive, dialysis has its own complication. In the kidney, it will also kill the kidney later on. I don't know whether I get the point. So now, but you can avoid this. It's very, very simple. Just like I told you, I was able to trace my family. I started monitoring everybody. It's not about, I believe it, let the weak say I am strong. If you are weak, say you are weak, so that your organ will give you excuse duty. Do you understand what I'm saying? Not when you are weak, you say you are strong. Please, I'm not against biblical this, but I'm trying to tell you the facts now. So now, this prostate, what are the symptoms? First, we have what we call dysuria. Dysuria. This, D-Y-S in Latin, means difficulty or pain. So dysuria means painful urination. You want to urinate. You are finding it difficult to urinate. Something that you can even be making call and be urinating. Now, if you notice that symptom, know that your prostate has to be checked. Number 2, we have what we call hematuria or hematospermia. Hema in Latin means blood. Urea means urine. So if you have seen blood in your urine, whether at the beginning of urination, at the middle of urination, or at the end of urination, you need to check your prostate. Now, there's what we call hematospermia. That one, people having sex can see blood in the semen. That one is hematospermia. Number 3, we have what we call increased urinary frequency. Somebody will urinate now. Before you know it, he will go again and urinate. Before you know it, he will go again and urinate. Before you know it, he will go again and urinate. I'm not in any way saying that it's only prostate that can give all these symptoms. Diabetes can also give you increased urinary frequency. Just like the pregnant women, they also urinate often, depending on the stage you are. If you have gotten to like 6 months and 6 months and above, when the pressure of the womb is on the bladder, you see the bladder will not, any little urine that enters, you go and urinate. Anything that enters, you go and urinate. That is by the way. So increased urinary frequency is another symptom that you need to check your prostate. We talk about urgency, urinary urgency. If I'm talking now, I feel pressed, I can tell myself, okay, wait till you finish this presentation. You can go and urinate. But if, as it enters, no, please, stop, I beg. Please, let me go and urinate. That is urgency. Or when you have gone to the convenience, toilet or lavatory, you want to ease yourself. You can no longer wait to remove your belt and zip yourself. It has started coming out. That is urinary urgency. Your prostate needs to be checked. Another point is what we call hesitancy. The word hesitates, hesitancy. Now, if when you get to where you want to urinate, the rule is that when you have aborted yourself, you bring out your penis and you want to urinate. And if you give instruction from your brain, or you urinate, urine should start coming out immediately. But if you notice that when you give instruction, it takes you some time for urine to start coming out, then your urine, your prostate has to be checked. Are we there? Then another point is what we call incontinence. There are people that cannot hold their urine. The word incontinent means inability for the gates. Like here, if we lock the doors, nobody can leave. Now, all these things in the body, like bladder, has its own gates we call sphincter. The sphincter of the bladder should be able to hold the urine, no matter the quantity, until you have told yourself, I can urinate. So at that point, if you are having incontinence, like the elderly people, we normally see it, they will urinate on their trouser. That's why most times you come to the hospital, we pass catheter, especially those people that have stroke, those people that are unconscious, and so on and so forth, because they have lost cortical control of their bladder. Normally when a child is small, the part of the brain, let me use a layman's language, the part of the brain that controls the bladder is on the bladder. That's why I always tell my wife, don't beat any of my child that urinates on the bed. Once he gets to 7 years, that child, the cortex, that is the brain, takes over the control of the bladder. I don't know whether I get the point. Now, the brain can say, as I am now, Mr. Man, stay here. When you are done with your presentation, you can go and urinate. So incontinence is when the brain is no longer having effect on the bladder. So once the bladder is filled up, you urinate immediately. That is incontinence. Another point we may talk about is what we call terminal dribbling. Terminal dribbling. Normally, if a man goes to urinate, you are finished urination. If the brain says to you, you are finished, then at that point, to you are finished. If you notice, after you have given instruction from your brain, stop, And there are still some drops, like 1, 2, 3 or more, that can come out independent of your will. That is what we call terminal dribbling. Your prostate needs to be checked. A normal man should, once you say stop, it will stop at that point. There's nothing like 1 or 2 drop again that you are not in control of. Then another point is what we call erectile dysfunction. Some men are no longer having erection to take care of their wife when the time comes. And erroneously, they will go and be buying Vega 100, Vega Plus, Manji, and other sex-enhancing medications. Let me warn you. Normally, these drugs, those sildenafil, they were not manufactured for sex enhancement. I don't know whether you know. They were manufactured for people with heart disease. That's why for people that visit cardiologists, at times they will give you all those drugs. To you, what am I doing with sex enhancing drug? I came here telling this doctor that I did X-ray. They said my heart is enlarged. And this doctor ends up, the sildenafil was manufactured for heart problem. The sex part of it, making the penis to rise, is a side effect. I don't know whether I get the point. And before doctors will prescribe it, they will watch your age. Because that drug, when continuously used, can cause a permanent impotence. We normally see young people, because you want to possibly, satisfy whoever it is, you go and buy those drugs. Please avoid them. You are killing you are going to have permanent impotence. That you'll be going to hospital, they will be collecting your money, doing all sorts of things. At the end of the day, they cannot cure it because you have damaged something that cannot come back. So now, erectile dysfunction is one of the symptoms that tells you you need to check your prostate. Prostate is not the only thing that can cause erectile dysfunction. Some men are diabetic. Some men are hypertensive. And one thing you must take care of your penis is that the penis has end arteries. The penis, the brain, the heart, the kidneys. You must be careful with them. End arteries means there's only one artery supplying a particular part, which when that artery is damaged, that place is damaged. If you see somebody that has had stroke, no matter the treatment you give that person, you see the person will be walking with what we call hemiplegic gait, no matter someone or the doctors in this world, because the brain has the same circulation like the kidney, the fingers, the toes, the legs, the penis, and all of them. So these symptoms I've named now are the symptoms that will make you to possibly suspect your prostate. If you notice any of this, what do? You can approach any hospital. The doctor will recommend a simple test called PSA. PSA. P stands for prostate. S stands for specific. A stands for antigen. So PSA is a test you do. The normal PSA value for a normal person is 0 to 4. So if I do screening, that is what I will also challenge the fathers in the house. Some people don't have, why some have. Then, the way it was in daily Christians, those that don't have will come to the church because they know those that have will sell their property to come and feed the church. So, I am also challenging the organizers of the Father's Day to also make provision where the members, because there are some people, you say, bring 5,000, 10,000, whatever. It will be difficult for them. But the church can assist them by running that screening test. If they do the PSA and it is between 0 to 4, you have no problem. Nonogram per mil, that's the unit. Now, but if it is between 4 to 10, they are watchful waiting. You don't have issue, but you are not well. So you are in between. We begin to monitor you. Maybe every 6 months, or every 1 year, or every 2 years, we'll keep on running the test until it comes up. But when you do your PSA and it is very high, see, in terms of cancer, no doctor has right to look at you and say you have cancer. The cancer can only be diagnosed by people we call histopathologists. when they do a biopsy, collect a biopsy, and hand it over to the histopathologist, they are the ones that will tell you if you have cancer or not. But by experience, that's why most times when they are looking for a doctor, they say 20 years experience. There's nothing the new doctor knows that the one with 20 years does not know. The only difference is the experience. Is the experience. By experience, when you do PSA and it's very high, we know we are dealing with a suspected case of cancer. And when it is detected early, it is okay. You can be treated. But when you allow it, it has metastasized. It has gone around the body. At that point, there's nothing anybody can do. That's the truth. There is nothing anybody can do. And from what we know, it is better you see danger, you take care of it on time, than you relaxing. And when it gets so bad, then you start calling doctors. There's nothing doctors will do. It's like I've exceeded my time. Thank you.
Dr. John, thank you very much.